Make sure the microphones, each of you can share two microphones, each two of you can share one microphone. So just move them so that they're easy to, you have to really bring your mouth right up to it or else people won't hear you.
Okay. Can you hear me?
Yeah, that's good.
Okay. How am I going to be able to read then? Okay. This is my first time doing this, so bear with me. My name is Gladys. I'm 62 years old. I'm not married now, but I have been married in the past. I have an adult child, and I'm a grandmother. For almost 40 years, I worked as an executive assistant, or a secretary as it was called in my early days of employment. My OCD is primarily contamination, resulting in lots of hand washing, long showers, cleaning, avoidance of things, places, situations, even people occasionally, that are presumed to be contaminated for some reason, for some OCD reason. Mine is adult onset OCD. My symptoms first appeared shortly after the birth of my child. Symptoms initially appeared as a lot of worrying about things that I was never concerned with worrying about before, and suddenly I was worried. The theme of the worrying was always, could this harm my baby? Was it clean enough? Whatever. But I was still able to manage my life. Then one day, the OCD really kicked in with a severe contamination obsession, making my life really difficult. I couldn't understand what hit me. I just didn't know what happened, what it was. So I went to look for a therapist. I saw two therapists. This was 1976 and 1977. Neither diagnosed OCD. I never had heard of OCD at that time, and apparently neither had they. The first labeled my issue negative grandiosity, and it does fit. But then I just didn't think I was getting anywhere with him, so I tried another, and he said he didn't like labels. He didn't name what I had. He was more helpful, and between him and the support that I had from some really great people in my life at the time, some of the people didn't even know what I was battling, but they were really inspirational to me. One in particular taught me to set goals for myself and for my therapy, which really turned out to be a good tool for me. I usually try to set goals for what I want, what to happen next. I got back on my feet and I went on with life, albeit with OCD as my constant companion, although I didn't know that it was called OCD at the time. I went without therapy for a good number of years, and one day I walked back into a therapist's office, and I actually, because this is such a hidden thing, I didn't tell him what it was. I hadn't really, except in the early days. Anyway, I told him about it, and he said that, I was diagnosed with OCD. I immediately went to a library, read everything that I could find on OCD, and I continued to search for everything. When I was internet capable, I went on the internet and looked up. And then I went to the OCF National Conference in 2001 and saw and heard firsthand some really great OCD therapists. So after that, I really believed that there was help for me. And I've gone through a number of therapists, and I must say that they got better and better over time as I knew what to look for. And thank God that the OCF had something on it that it told you what questions to ask and so forth. But it's all worthwhile when you find a really good therapist. I've just recently begun treatment again, and with a new therapist, and I have really lots of hope for learning to manage and control my OCD under my therapist's guidance using ERP, basically. I kind of look at it as ERP is for me. It's a daily struggle, but facing down OCD every day. But I think it's well worth it. I'm really, really new to therapy with this therapist now. Not that I'm new to this type of therapy, but I really feel like I've had a few successes, and each time I have a success with the therapy, it builds my confidence. So I really am looking forward to getting back some of my life with this, and I hope that there aren't enough of you around, whoever here is an OCD therapist. I would hope that young psychology students today would really want to specialize in OCD, because I think we could use it. Geographically, it was really hard for me to find somebody close enough to drive to. So that's my story. Thank you.
Actually, before we continue, I forgot to do this, I usually do this. Just the fact that these people chose to be up here and to be public, I think, warrants a hand from all of us. Okay, why don't you just turn the microphone so that it is facing you and try to get as close to it as possible.
Hello, is that it? Okay, too short. My name is Melanie. I'm 23. I just graduated college in June, and I work now as an accountant. I'm not married. I live with my boyfriend. I don't have any children. And I have Tourettic OCD. I have Tourette's, OCD, post-traumatic stress disorder, panic disorder, and I had an eating disorder for about 8 years. So you'll probably see my face tick a lot because I get nervous with the Tourette's. Mine started where it onset was about, I was only diagnosed with OCD when I was 17, and Tourette's only when I was about 21. But we can trace it back when I was 4 or 5, all the symptoms. And it's also genetic in my family, we've now discovered, back 4 generations. So it is something we found is very genetic. And we have panic and anxiety and depression are also known genetic in my family. So the prevalence was always there. When I was about 13, I had my traumatic event. I had a food allergy and my throat closed and I thought I was dying. I went to anaphylactic shock. And so they did all the treatment and everything. And after that, I was afraid to eat. I thought if I ate anything, my throat was going to close, I was going to die. So that's where the post-trauma came in. And so I immediately, and I didn't eat for about 2 weeks. And so I was immediately taken to the hospital, and that's when they said, you know, this is post-trauma, you have anxiety, and they put me on Xanax. So I've been on Xanax now for about 10 years straight. I don't know why a psychiatrist would give a 12-year-old Xanax, but so I've been on that for a long time. And so the problem was I was afraid to eat. I couldn't be force-fed, and they wouldn't do it intravenously. So I started seeing an eating disorders doctor. And it was also at the time, I had a lot of compulsions, I had intrusive thoughts. I didn't speak about them because the big priority was she's not eating, we need to figure out what's wrong. So I worked with an eating disorders doctor for a long time, and I got down to, this started when I was 13 and it ended when I was about 21. So about 8 years, all I ate was Poland Springs bottled water, Coke, McDonald's chicken nuggets, peanut butter, and Kraft macaroni and cheese. And then I'd have 2 to 3 cans of Slim Fast a day just to make sure that I was getting calories and nutrients. So it was about 95 pounds. And that went on for about 8 years. There was also concern about my general health. And we kept trying the different therapy and trying to eat, and I was afraid. I refused. And at the same time, I was having very violent panic attacks at the same time. So my panic disorder was really getting in the way of me eating. All the while this was happening, I had these compulsions that I was able to hide. I was counting things. I was nervous. If I got nervous, I had a lot of superstitions. If I was afraid that anything I did, something bad would happen, or if I didn't do something, or I thought something bad would happen. At the same, so my OCD isn't really, I don't have as many compulsions. I like to have things symmetrical and straight, but I suffer more with obsessions and intrusive thoughts. I'm afraid people are trying to kill me all the time. I don't like being anywhere in the dark. I don't like being in front of my own house in the dark because I think someone's gonna run up and kill me. Showering is very difficult for me still. I probably saw a horror movie and I'm afraid if I'm in the shower, someone's gonna come and kill me while I'm showering. So my real struggle is intrusive thoughts, which no one talks about. So I never knew it was OCD. I thought when I was 14, 15 that I was schizophrenic or I thought I was crazy. And so I didn't tell anyone. Finally, one of my parents brought up to my doctor that, you know, I keep arranging things and when someone moves it, I get mad. So they mentioned that to the doctor and he's like, I had no idea. And then when he finally asked me about everything, he immediately diagnosed OCD with a lot of obsessions and intrusive thoughts. So there was about 5 years that I was being treated that OCD wasn't even a thought, it was just an eating disorder. I'd only worked so far. I was able to maintain a regular life. I graduated high school, I had boyfriends, I had friends. I went to college, I was vice president of my sorority for 2 years. But the eating was getting worse and worse. I was down to like 95 pounds. And we had to make the decision. I was also having trouble, I wasn't medicated properly. I was on Xanax and I tried Prozac low doses, but it didn't really work with the obsessions. It kind of calmed me down a little bit. So we made the decision to start an Anafranil. We went through the SSRIs and we went to an Anafranil. And so I switched psychiatrists, went to an Anafranil, and the decision was made that I need to be brought up to a high level of an Anafranil, but to do that safely as an outpatient because there's a lot of side effects and doing blood work and monitoring, it would take about 2 years to get to the level that he proceeded I needed to be. So the decision was made. I was hospitalized in McLean Hospital. It's an inpatient psychiatric hospital. They call it the OCD Institute, but at the end of the day, you're in a psychiatric hospital as an inpatient. So I was there for, this was 2 years ago. So I was 20 years old. I was there for the full 3-month program as an inpatient, which is the longest you're allowed to stay as an inpatient. And I'm now, so about 2 weeks ago was my 2-year anniversary of being released from McLean Hospital in Boston, which I'm very proud of because I've not had any major relapses. And my doctors view me as a success story because I gained 40 pounds also since being released from the hospital, which is nice. So, and I'm able to, since being in the hospital, I've traveled to different continents. I've traveled around the country. I've graduated college. I've maintained relationships, and I can actually eat food now. So it's...
Hello. All right. My name is Phil. I'm 17. I'm not married, and I still live with my parents. So I had OCD from about 7th to 10th grade, and it really started in about 7th grade, but I wasn't diagnosed until probably end of 8th grade, beginning of 9th grade. And at the beginning, I sort of thought it was just superstition almost. I played baseball, and a lot of baseball is superstition. So I sort of thought all my thoughts were just really superstition. And the first thing, my mom actually noticed it. I was moving my cup around like 30, 40 times at the dinner table, and she said, "Are you OCDing?" And this is in 8th grade. I didn't really know what OCD was. So I sort of didn't really think of anything. My mom sort of got information about it, but we sort of started fighting after that because she was telling me to do stuff I didn't really want to. And it sort of occupied my personal life. I was counting a lot. I was moving things around a lot. And it didn't really affect anything else until I remember a 9th grade geometry test. I didn't even come close to finishing it because I was putting my pencil down on each word a whole bunch of times, and I did really bad on the test and didn't even come close to finishing it. So after that, I decided I really needed help, and I went to a great doctor, probably changed my life, definitely changed my life, and like I can't thank him enough for it. And right now, I'm 2 years after. I'm probably, I'd say 98% free with OCD. It still comes back sometimes, like if you're in a stressful situation, you have a test the next day, relationship problems, but I think a lot of things are constant now. I have like a really good set of friends. I have a girlfriend I've been going out with for a year now, so a lot of things are really constant. I think that helps with the OCD, and now I know enough strategies and enough techniques to get past whenever I feel like I need to do OCD, so I think it's a lot better now.
Hi, my name is Emma. I'm 11 years old, and I think that my OCD has been there since I was like really young, maybe 5, but it was never really bad. It was never like I would feel short moments, but then when I was about 10, it just started really hitting me hard, and I was having a really hard time and at home, and I would cry a lot, and I wasn't able to concentrate a lot of the time. So I was going to a therapist for about 4 years, and my parents weren't really sure what was going on. So about a year ago, I was diagnosed with OCD. I take Prozac right now, and I just finished up a therapy session. I've been doing that for a few months. It still comes back every once in a while. I can't really ever get rid of it because it's a part of me. But I'd say I'm much better. I don't have as much stress. I used to check doors at night. I used to wash my hands a lot. I used to reread so much, which annoyed me because reading is one of my favorite subjects, and I love books, but it frustrated me so much that I would just have to put the book down. But now I could just read the book like as a normal kid. I used to obsess a lot about things. I couldn't get things out of my mind. If something was bothering me, it'd be like I couldn't stop thinking about it. Like if I had a test, I'd say I'm done, I studied, but then yet I'd keep on going through with it, and I'd be all nervous all during the day, and it was just really hard for me. But school was like one of the only times that I actually felt better. In school, I didn't feel it as much as usual because and that's my favorite part of the day, but when I got home, I wasn't really occupied a lot, so it would usually come out and I would rearrange things and I just get like really bad. It affected my family. I mean, it's hard for them, and I wish it wouldn't be so hard for them, but I'm getting much better, and I really hope that how I've gotten better is helping them out. So, thanks.
Can everyone hear me? No. Are you good? I hope I don't get upstage. My name is Bridget and I'm 15 years old. I go to High Technology High School. It's my second year there, so it's fun. My OCD started about in 6th grade. It was more perfection than anything with school and with swimming. I'd actually get so nervous when I'd go swimming that I couldn't swim. I'd just start hyperventilating, have to go to my coach, have to talk to him, be like, I can't even try this because I know I'm going to fail it. But then about last year changed over to contamination thoughts, contaminating people, contaminating things. And it actually got as bad to contaminate everything in my house. So I had to move out of my house for about 8 months. And it doesn't take long for everything to get contaminated. So my ritual was avoidance. That's why I left my house. My dad was actually a really big source of contamination in my brother, so I couldn't see them or even think about them for my brother for 5 months, my dad for 6 months. So as you can tell, that would affect my family a lot. I can't speak for my brother and my father, but I can't even imagine how it would feel to have your daughter or your sister not even be able to think about you. Because it's hard to separate me from the OCD, especially if you don't have OCD. Because I know it's not me that's afraid of them, but in some way they have to think, what did I do wrong? Why is she so scared? Why does she freak out every time she's near me? So that has to be hard for my family. And then my mom, which is actually here, I don't want to steal her thunder, but she's just done a lot for me. She had to be patient, and any parent with a child with OCD has to know that you can't push them too much. You want to do everything you can, even though I get frustrated with her and yell, which I'm not proud of. During my OCD and exposure, she's always there, and, well, I'm saying too much about that. Then my schoolwork my freshman year, because that was when I was living away from home, was affected by my OCD, but I tried to stay in school as long as possible. I actually did. My school is very small. My principal was very supportive. I actually didn't tell anyone I had OCD, so all the kids were like, "Where are you, Bridget?" But to those who inquired, I kind of made it up with excuses. But so that got through. Therapy is just typical cognitive therapy, touching things, thinking things that I don't want to. And many people might have seen the ABC Primetime special about the OCD, which I was featured on, and I kind of act my exposure out, my anxiety. I turn into a smaller girl, which my therapist said is very unique to me and kind of entertaining. He kind of laughs when I freak out, but I don't know. So he thinks I'm entertaining, but yeah, the people that have seen the show, I guess, see it more up. It's more relevant to them. Well, now I'm back home. It's actually been more comfortable than I have been in years. Being at home, I can go to more rooms. I can bring my clothes, my swim stuff around, which I've been working on. Even though it's been about 4 months since I've been home, I still have to do 45 minutes a day of intense therapy. It's hard, but it's getting done. It's, and I always say, even when because a lot of things have been taken back by the OCD, and I'll always say it's different. It's not the same now, but the OCD always tries to pull the same tricks. And as other people have said, they still have the OCD, but you can make it so small that it becomes irrelevant in your life. So that's what we've been working on, and that's what my therapists have been working on too. So.
Hello, my name is Karen. I'm a registered nurse, and I've been married for 22 years to my husband, Redentor. I have 3 children, Thomas, who's 20 years old, Mark, who's 17, and my daughter, Bridget. Everyone you talk to would have described Bridget as that model that fixed the perfect child. She was smart, pretty, athletic, hardworking, fun-loving girl. and no one ever thought she had a worry in the world or a problem. But she was battling a lot of stuff in her head, and like any people, she kept it hidden for a really long time until it just got too strong and too overpowering. She was first diagnosed when she was 11, and we started therapy and a medication regime, and it went away. And we thought, problem, fix it, it was gone. We didn't take it very seriously, and I feel bad about that and guilty that if I had done education then, that her reoccurrence might have been just a little bit less. Seeing Bridget become so afraid to be in her house, to be near her brother, her father, and eventually me, just was so difficult to understand. So we took her away from those things that made her so scared, because that was the only way she could just even begin to do any kind of therapy. But I never thought it would take 8 months to bring her back home. And during those 8 months, life was stressful. I lived with my mother and Bridget at my mother's house, so I was mother and daughter. And I would go back home as much as I could, and mother and wife when I could. But when your child is fighting for her life, you could learn to do anything, and we did. I learned to educate myself and research all about OCD. We learned how tricky, how mean, and how complex it could be, and what a fight Bridget had on her hands. I learned not to blame Bridget. It wasn't her fault. She didn't want OCD. She didn't want the family to be apart, and I hope she knows that we all feel that way. My husband and I learned not to blame each other, which was hard. We didn't see each other a lot, but when we did, we tried to be as positive as we could, and just kept going back to the fact that Bridget was strong, all the little positive steps we kept bringing up to each other whenever we felt negative. And there were a lot of negative thoughts. You know, the therapy was going so slow. What if it didn't work? So many things. But for some reason, we just, instead of coming apart, we did come together, which really made it well. We learned that educating ourselves was the best thing. We learned that questioning the therapist was okay. We learned that researching ourselves and asking the right questions when it didn't work, and knowing it was okay to move on when the fit didn't happen and you had to do something to help her. I learned that my boys really did listen when we talked about family support, because they were great. Tom was the only one Bridget felt comfortable with, so he was at college, but he would call. He would be on the computer, he would come down, take her to lunch, just be there for her. Mark, my middle guy, just took on so much responsibility. He was home alone a lot, and he never complained. And he learned how to be a really good cook, I have to say. And I learned that my 71-year-old mother is really a strong lady, and I couldn't have done it without her. I learned that I had a lot more patience than I ever thought I would have, and that you need it with OCD, because that's all you can do. Even though I wanted to be in there and just actively take that pain away, I couldn't. All we learned to do was be patient, give support, and to use a lot of gentle persuasion with Bridget to get things through. I learned that Bridget is just really a truly brave girl, that she went into this for a really long time and tried, and when she finally got the ERP therapy working well, she just started down the road very quickly in order to get back home. The one story I'll tell you is about the therapy we did for her to try to see her dad for the first time. ERP therapy, Dad sat in a car in front of the house in the driver's seat. We sat up on the top of the hill on the other side in our car, and we slowly began to drive down, very slowly, until we were opposite each other. And usually Bridget we wouldn't get that far. We'd have to drive away or stop. But this time we were completely opposite. And she didn't hide or tell me to go, but she went over to the seat and rolled down the window and, said, "Hi, Daddy. I'm trying to get better. Please wait for me." And then we had to go. But that was the first time Red had seen her in 7 months or heard her voice, or Bridget was able to say the word Daddy. So that was a very positive motivating factor, and things just seemed to spread from there. So we learned that it will work. It's hard but it does work. You just have to stick in there. And, you know, I learned that my Bridget is the perfect child, intelligent, pretty, fun-loving girl with OCD.
Can we pick them or what? One more hand for everybody. Okay, this is your chance. Come on up. Come on down, like they see on the game shows. And if you know you have a question, you can come up and just wait here so we don't have to wait for each person.
Thank you all, you're so inspiring. I have a question for our second speaker. How did you get to McLean Hospital? What prompted you to make that step? Was it to be getting your anafranil to where it needed to be, or did you make a decision?
It was recommended when as soon as he diagnosed me with OCD at 17, that he knew I needed to be hospitalized. He knew how severe it was immediately, and I was like, no. At that point, I'd taken myself off medication and become violent and manic, and the last thing I wanted was to be in a hospital. When I was about 20, it got unlivable, really. I got into a depression. I think there was about a month I didn't leave my room. We realized I wasn't medicated properly. I finally switched psychiatrists. And I wasn't really depressed. The thought of suicide was never there, but it was really like, you know, I feel like I'm gonna die every day. I guess it wouldn't really matter if I did. And you didn't, because I wasn't living it. I wasn't eating, I wasn't living. I was sitting in my room terrified all day. So the first push was that when the new psychiatrist to push me into it, he said, if you went to McLean at the hospital, they could safely bring you up to the level of anafranil you need in a 3-month period. So every 2 weeks we did a drastic increase. I got blood work done each week. So there was the safety issue of bringing up the medication. I was ready to go. I was at an acceptance level. It had been 8 years, and I was really hungry. And it's hard at that age period. I was in college. My 21st birthday was coming up that year. I wanted to go out to the bar with my friends. So it was definitely a level of acceptance, and there was health concerns. I hadn't eaten well in 8 years, and I was ready for it.
So the anafranil really worked?
Very well. I went through the different levels of SSRIs. I tried Luvox, Prozac, all different levels, Xanax. So I'm on right now a twice daily dose of Xanax and a nighttime dose of anafranil. I like being on a higher dose personally of the anafranil, but there's a lot of there's a lot of strong side effects, which is why you don't go on it right away. So the higher dose I enjoy more. My obsessions are easier to deal with at the higher dose, but it takes away some of my functioning ability, and the side effects are too hard at that point.
Thank you.
Hi, this is directed at some of the teens on the panel. I have a 14-year-old with OCD and an 18-year-old with BDD and OCD. My question is in terms of if you've kind of come, out of the closet, or how public is your, are you about talking about your OCD? Because with my older child, I think when he was first diagnosed, we were more stigmatized or concerned with the stigma, and it's a little bit different with my younger child, having been through it. So I'm just wondering, because my older child doesn't really talk about it with his friends and peers. So I'm wondering what your experience has been with that.
Well, personally, since I went on a national TV show about my OCD, but I actually didn't tell any of my friends or any of my schoolmates or any of my schoolmates about the TV show. So I guess it's kind of an oxymoron that I went on a national show, but I won't tell people close to me. But I feel if I did tell people about it, they'd be supportive, but for some reason, I'm just not going there. But that's just a personal thing because I'm more reserved. But I think if any other teen, like other than myself, I guess that's being hypocritical, but they should trust their friends enough to say OCD because it's just a normal thing. It's just another disease, which is a lot I've learned because when I first they said I was diagnosed with OCD, I'm like, wait, but I don't count things. I don't close doors. I don't wash my hands. So I didn't really understand it, but I guess if more people understand what OCD really is, then you can be more comfortable talking about it.
I think the tough thing about OCD is that if you don't have it or you don't have anything like it, it's really hard to sympathize with someone who does. So that's why a lot of people with OCD, I sort of feel, don't make it public. And so personally, I told my closest friends And if someone said that they had OCD, I'd sort of talk to them about it. Because when you have OCD, it's hard to keep it bottled in. But on the other hand, it's hard to tell people because they just don't know. They don't say, why don't you just stop? So that's the sort of really paradoxical thing about OCD, and that sort of made it tough. But finding a good therapist and finding people to talk to, I think, is really important.
Hi, this is for Melanie. Melanie, you said you work as an accountant and you have accounting obsession. I was just wondering, like with the anacronym, I'm wondering like if there are symptoms of counting that you have to still deal with at work.
The counting is really more related. It's the anapranil and a lot of the therapy work has really subdued the counting and the compulsions. My counting is really more related to superstitions. I'm afraid to negate the superstition I have. Well, if I count to 4, the superstition will negate away.
Oh, I see.
So it's really more of that.
Okay, thank you.
A question I have, I'm Emma's mother, is I picked up this theme of a traumatic event triggering OCD, and one of the panelists said they were doing well initially, and then another traumatic event happened, and they relapsed. Did anyone? My question is, with OCD, though everyone's doing well, there was, it appears to be linked, the onset, to something happening. And do you prepare yourself? How do you prepare yourself mentally? Because life is hard and things happen. And if there's another traumatic event or something sad happens in your life or a big disappointment happens, do you worry that the OCD, you'll relapse? Or do you feel like you have the skills, you're on medicine and you have the contacts now that you would never let it get that bad as it did in the past?
Well, as my mom knows, I think my trigger event was when I was five, I think. My grandfather committed suicide. I haven't really thought about if something else bad was happening, because at this point I'm just kind of thinking about what's happening right now at this moment and trying to fight what's happening right now. I mean, I guess if something was to go on, I have a great therapist and I think I'd be ready to take it on.
I was going to say, to answer your question, the big thing, I talked, because mine seemed to be onset by a traumatic event at 13, but when we look back, and I talked about this a lot when I was at McLean to try to figure out, was there a trigger? When we look back though, it's genetic in my family, and I showed symptoms when I was 4 years old, 5 years old. I always had extrasensory Tourette symptoms. I always had obsessions, and I was a nervous child. But what we talked about was that OCD onset and a lot of mental illness onset happens at hormonal points in your lifetime. So either at, when you're pregnant, at a menopausal age, or at a puberty age. My traumatic event was right around puberty. So a lot of the onset happens at that time. So it can seem like and if my predisposition was always there, I was 4 years old, 5 years old, one traumatic event is going to trigger me to go full into that. As far as relapse prevention, there's, also being at a hospital, they say, you need to prepare yourself. You're going to relapse one day. Nothing's perfect. When I got back from the hospital, there were 2 weeks where I would only eat 2 things. You have to, it's not, the way I look at it is I'm not preventing a relapse. It's going to happen at some point. Some days are harder than others, but I'm learning to manage things. If I know I'm having a harder day, I change the way I situate the day. It's all about, I'm going to have it the rest of my life. It's about just managing my symptoms day by day, week by week. And I'm not looking for the relapse, but I know if it's there, I'm prepared, I've done all the work, I've put in the time, and if I'm not able to, I have the support system that can help, pick me up when I need to and put me in the right place.
Okay, we have an empty podium up here. No one has any questions for these people? Nobody? We'll wait.
I have another one. Can I ask another one? I've already asked a question, but I have another one.
Hi there. I wondered if the panel could comment on the role of medication versus the therapy sessions. I've got a son that's 23, just started therapy. He's been OCD for a long time. We didn't really realize it. And he's reluctant to take medication because he thinks it'll change who he is. We think medication will help him deal with his condition better. So I wondered if you could just comment on the role of medication in your therapy and whether you felt it changed you, whether you went off it, on it, just in general to give me some guidance on the role of medication.
Well, personally, I'm not sure if it's just my medicine is not working, but I don't feel a big change. Like, I do feel calmer when I'm on medication, but there's not a big change in myself. So we've actually been trying to play with my medication, more dosages, basically. But it doesn't really, well, I take Prozac and Boost Bar, but it doesn't really change anything. It just makes it easier to calm down the OCD symptoms. So it like slows the compulsion, the obsessive thoughts down, so I have time to fight them.
Yeah, I agree. I take Prozac also. I was afraid to take Prozac because I thought it would change me as a person, but it doesn't change you as a person. It kind of just puts the OCD in a box, and it kind of quiets them. But you know, the therapy role also plays a part because the therapy keeps them, you know, in that box. The medicine only does half the work, in my say. You have to put an effort in to do the rest of it.
I had different problems with medication. There was a while that I decided I was 17, 18, and I was like, I don't want to be on medication, and I refused to take it. My mom would watch me take the medicine, and she'd watch me take it, and then I'd turn around and spit it out after. So I took myself off medication for about 6 months. So I understand, you know, there's a defiance. I think it was for my part as part of the acceptance. I don't want to accept that I need medication. I don't want to accept that I have mental illness. So it was part of that. I just didn't want to deal with it. But I had medications that didn't work for me. I was on Luvox for a period of time, and it made me manic and violent, and I couldn't go on that. I had to take myself off of that. I do understand there are some medications that I didn't like, and it did make me not feel like myself. It was too strong and overclouded, but then I was able to find the right medication, which for me was Anafranil, that I was able to function and still feel like myself. So a lot of it is just the trial and error with the medication.
Did everybody who wanted to answer that question? Okay, just check. Again.
For the young people on the panel, or even the mom and the adult, advice to parents. What would you say? There are many parents in this room who have, our son is 23, he has BDD. He's been ill with OCD and BDD for 12 years. What advice can you give us for his recovery?
I think you just really have to be patient. You know, my parents are really good. You can't get frustrated because of the fact that, you know, it's not the child's fault. You know, and if you give them the right support and you push them in the right direction, if they're motivated, they'll take the rest, and then, you know, we'll have a dramatic change. That's what I say.
I think the important thing for parents is, as Bridget said before, not to take it personally. It's really hard to do that, but patience is a really big thing. So if you're patient and you don't take it personally, I think that really goes a long way in helping the kid. Even if they don't show it right away, it's going to show eventually.
I know for me, just being honest. Just really being honest when someone, you know, says, you know, where was Bridget? we said she has OCD, and tried to explain it to them, and you'd be surprised how much the doors open more than they close, that people really are understanding, and they will give you a lot of support. And finding a good therapist, one that fits your child or your young adult is important. It doesn't always fit, it doesn't always write. So keep an open mind and keep looking, and that's advice.
Well, my therapist actually tells me to think of my OCD as a she, so it kind of sounds weird and kind of crazy, but like we reference my OCD as she, so she is making me do this. So I guess that's a really great way for parents to think about it. She is a different part of me. She is Bridget, but I am Bridget too. Like, I'm the real Bridget. So when I have my OCD things, when I'm yelling, when I'm saying I don't want to touch you, I can't be in the same room as you, I can't live with you, it's not what they're thinking, it's what the OCD is thinking. So just think of it like an anti-you.
Hi, I'm Melanie's mom. As a parent, I would say also one of the things that I found helpful was make sure if you're not accepting, if they're not getting the right help, you don't always have to accept it. Like, try to say this is still not okay. And at one point, and she said, I point out to the therapist, the therapist was good about letting me let him know. I mean, he didn't tell me things without permission if I didn't want to, but she would present certain points to the doctor and keep hidden other things until we found out. And then I would point out to the doctor something else he had no idea about, her moving things. That's how it kind of found out. So sometimes you can't just always accept what you're seeing. If you're not seeing improvement, you kind of have to keep looking out there, because it's not always okay. Some of the things are not always okay, and you have to realize, like, okay, we need something else. So sometimes you have to talk to therapists and let them know things that because she was really good at hiding stuff, including going from one doctor telling one story, another doctor another story, until they didn't talk to each other, and we realized they had to have a conference, and then they pointed out what it was. So.
I just want to thank all of you for sharing. I'm really touched by all your stories, and especially with how you've just really hung tough with it, and how open you are. It's really valuable to me. I'm a social worker in the field, and I also have a family member that has OCD, so I just want to thank you. And I also wanted to ask, when the symptoms interfere with school, how helpful was a school, like more for the younger people, how helpful was school as far as understanding how to help you out or make accommodation, and what would you wish that they would have done or didn't do?
I was going into college and I was still suffering a lot, so what we specifically looked for was an institution going in that I knew would support me. So I chose a small private college. I went to Rider University around here, and as I was accepted, I met with the deans. I met with, my problem was eating. I met with all the kitchen staff. I found that my specific university was very supportive because we went ahead of time. I worked with counselors months before I was even admitted. And so we went out of our way to make sure that because I knew I would not function in college. I needed the experience to get out of home and to have a life, but I couldn't function unless everything else was in place. So I specifically sought out a university that would help me do that. So then they were really very helpful.
Luckily for me, I attended a high school that has less than 300 kids, because it's like a specialty in engineering. So my principal, my brothers had gone there before, so the principal was very supportive, and even the staff, like, they all knew I had OCD. Like, I didn't actually tell them because I wasn't comfortable at the time, but my mother had, and they all talked. They were very accepting about, like, notes saying, like, Bridget couldn't study, Bridget had to have time with more homework. And I think it was really helpful because even though they never really said, oh, Bridget, how's your OCD going? They were always asking me, like, are you doing okay? Do you need an extension? So they knew I was working hard, and they knew I wasn't slacking off, but that support just really helped me get through my freshman year. Because freshman year is hard enough without OCD, but having it is missing so many days. But I think my staff, and especially the school, was very supportive.
This doesn't really answer the question, but, no one at my school knew, so.
My name is Dr. Cindy Haynes, and while we're talking about schools, I just wanted to tell you that on your desk, on your tables, you have a flyer that talks about what we do as part of the New Jersey Obsessive Compulsive Foundation. We have a packet of information that in a 10-minute presentation, you can go into a school and talk to school personnel, teachers, guidance counselors, about what to look for in children in the classroom, what signs, symptoms they may be exhibiting to recognize and better help with OCD. So if anybody is interested in making a presentation, going into a school, please call me. We are at Stress and Anxiety Services, and you can get me at, I'll give you my phone number. Oh, it's on the paper. And just ask for me, and I will be happy to call you back and tell you and provide you with that information. It's all done for you. It's all in a packet, and you really basically just have to go in and read it. It's all there. All right, so thank you.
I saved the last question for myself. I guess I wanted to ask all of you on the panel the following question. No one would wish this upon themselves and upon their family, of course. But seeing as you've gone through this, what would you say were the benefits of having had this problem and this struggle?
I think that it's probably made me more tolerant of other people's disabilities and problems. And maybe made me a little bit more patient, too.
I take offense to your question because I don't find much benefit. There's nothing good about mental illness. It's hell, you know. It's especially depending on any age. It's not fun. There's no benefit from it. I've lost relationships. I've ruined friendships. I've hurt family relationships. I've lost finances. It's not beneficial. I've become an empathetic person, maybe. But, you know, am I a little bitter? Yes, because, you know, I lost 8 years of my life in, you know, a time in your life that you're trying to develop and grow and change. And I've become an empathetic person, and I understand when other people, you know, I feel more empathy with mental illness and other people who suffer too, but I'm not going to say it made me a better person. It's made me aware. It's made me a very good patient, but not better. It's not who I am. I'm a different person. I just have mental illness.
I basically agree with both of you. It has its pros and cons. I mean, it brought my family, I guess, closer together because now we understand each other better. And also, you know, it could, you know, at moments I don't want to, my family doesn't want to see me and I don't want to see my family because it could be hard, you know, being a parent of someone with OCD. So I'm kind of like in the middle of that subject.
You can see Emma on the new ABC series starting next week.
I think at the time, in like freshman year and sophomore year, it made me a better student. Because you're more of a perfectionist, for lack of a better word. So you want to study more, so you know everything. You want to make sure everything looks good. So it definitely helps your grades. But I think in the end, it made me a stronger person, made me more like aware, as everyone else said, and more able to get over things that come up in life. Because mental illness is sometimes unavoidable, and if you're able to get over that, you think, why can't I get over anything else?
Okay. You can all breathe now. Well, that's basically it. I'm going to have Ina Spiro come up and say some closing remarks, but one more time I want to thank you all very, very much.